Hi, everyone. Thanks for joining us on the Clinic Talk podcast. Today, I have a special guest, Tannia Cisneros. She is an occupational therapist in the Bay Area in California. Tanya, how are you doing today?
Good, good. How are you?
Good. Thank you for asking. So thank you for joining us. We'd love to chat a little bit about yourself and your practice, if you can share with us. So let me know if you're ready to begin, and we'll jump right into it.
Sure. Yeah, let's go ahead.
Awesome. So first question is just give us a little background on yourself. I know you're an occupational therapist. So what led you to become an occupational therapist?
I had finished college and I had taken a job at a big hospital and was looking for careers in healthcare. And my boss actually led me to OT and I started to shadow OTs and I wanted to do something that was more directly caring for patients. And that's how I got into OT.
Cool. All right. No, that's awesome. I'm an OT myself, so I can relate. It's a big field. It's a rewarding field. So that's great.
Mhm.
So you are an occupational therapist, and how long did you practice for before opening up your own business?
So I had been in OT for about 10 years and I had been a traveler for some time. I ended up in San Francisco or in California traveling. And uh, then my husband's also an OT, Myron, and we both were just working everywhere, every single setting that you can think of, and we were tired of productivity demands and wanted to do something that was more meaningful. And that's why we co-founded InGym.
Awesome. Wow. So, and yeah, and I can relate to that because when I graduated, I also did every single population. I was everywhere, night and day, just doing, trying to kind of find your niche, right? See what works for you. So great. Thanks for sharing. And just going back to your husband a little bit, did you meet your husband during that 10 years that you were working and then decided to open up a gym, or was
Yep. I met him at my first travel assignment.
okay? Okay, so cool. And then you guys had the idea and you opened up in gym.
Yes, we've been a therapist for quite some time already, and then we decided to open up InGym.
Awesome, awesome. Okay, and so what was the kind of inspiration to open up in gym, and tell us what type of practice in gym is?
Sure, it was a little bit of a journey. So from the business side, I had started working as a consultant for a startup company who was doing home health. So started kind of getting a little bit into the management piece on my side. Myron, on the other end, really wanted to go into pediatrics and was starting to see kids anywhere he could see kids in the park. He did home visits, but school visits, but a lot of the times, we mostly see kids on the spectrum. Kids just needed to move and be out, so playgrounds and parks and, community centers were a place where he would just conduct his sessions. Started building quite a clientele and, he would come home and he'd be like, "When are you gonna open my ch what very s good." That's how essentially InGym came about. I do most of the management, I don't treat anymore, and Myron is the clinical director.
Awesome. Cool. Thanks for sharing that. So on you being more on the management side, how many employees do you have? What does your team look like?
Sure. So we have 3 full-time therapists. We have about 6 part-time therapists, and it fluctuates. Our goal is really to have 5 full-time FTEs consistently, with Myron being afloat, because we have an 8,000 square foot facility, and the overhead is quite a bit.
Bay
The
Area, right? It's
Yeah, and in the Bay exactly. So our rent is a chunk of our revenue. So, yeah, that's the goal, to continue to hire. We have clientele, we just need the therapist.
yeah, yeah. So I'll ask you a little bit about the therapist and hiring part. Aside from the therapist, do you have any staff members that help with kind of intake, any patient coordination, billing?
Yes, we do have a very part-time, person who helps us. He is also our adaptive personal trainer. So he's a certified personal trainer. He's working under the ATs right now to work with kids in the spectrum, and he helps a lot with our groups. So he's personal trainer slash aide slash clerical. We all wear different hats. And then the rest of the stuff is just me. Yeah, the rest of everything is just me. Yeah.
Okay, very cool. So do you treat as well or no?
No, no, there's no
I love
doubt
it.
I could do everything. Yeah.
Got you. Okay. All right, cool. Thanks for sharing that. So as far as because it's a big facility that you have, which is nice. So how do you kind of let everybody know about your clinic, about InGym? Do you do any marketing? And if so, what type, or is it more word of mouth? What does that look
Sure.
like on your end?
So historically, how we started was word of mouth. And because we are in pediatrics and because we are in a population that really has to establish a relationship with the clinician, it was really just word of mouth. And it continues to be that's just our main source of new clients is word of mouth. However, recently, because we can't do anything without social media, we are kind of having a little bit more of involvement in social media. And I do have to thank my staff for that because they're really the ones that are kind of trailing the road. We have Karina, who's in charge of the post, and Hannah, who does the videos, and we also have Sai, who's our business development. So we do have a business development person,
Oh, nice.
and she does the design. She does great work with design, and she will design the post. So there's a team behind it now to promote social media.
Cool. Awesome. And sorry, I don't remember if I asked you, how long has InGym been around? When was it established?
2017. So this is eighth year.
Hey there. Congratulations. Awesome. Awesome.
Thank
Cool.
The company itself, Myron and I have been in private practice since 2012. So the company itself has been around since 2012.
Very nice. Okay. So as far as marketing goes, like it seems like word of mouth is your biggest referral source. And as far as insurances versus cash pay, how is InGym established?
Sure. So we would be dead if we were to take insurance, if we were to bill insurance directly, unless we had the volume of therapists to take in the influx to be able to wait 30, 60 days for insurance to reimburse, right? So we have never built insurance directly. We are a fee for service facility, but we do help our clients get reimbursed from their insurance.
Gotcha. Okay. All right. So you provide super bills and you do whatever you need. Okay. All right. Excellent. And as far as the kind of age range that you support in gym, is it pediatrics? Does it go up until adult or geriatric, or do you?
Pediatrics, we serve at 0 to 22. Um, One of the things that is coming on for InGym this year is a young adult program because we have these clients that we've been seeing since they were 5, and now they're teenagers. And a lot of those clients will go to post-secondary, and then they have nowhere to go. So one of the things that this year we're working on InGym is developing a young adult day program, which will service adults from 18 to 25.
Okay, very nice. So this is a new program based on need that you guys established. Awesome. Okay, very good. And currently you do have one location, right?
Correct. One location.
Are there any are there any plans to kind of branch out other locations, or even like a franchise model? Because it sounds like a good.
Mhm. Yeah, yeah, we've been talking to people. We're trying to figure out, what would be the best thing to do, and that's a decision that we need to make as we continue to scale. Do we want to franchise? Do we want to just do other locations? Yeah, so that's definitely in the works.
Okay, awesome. Thanks for sharing that. And you and Myron, your husband, both therapists, are co-owners. Is that correct?
That's correct.
And meaning you don't have any other partners, right? So it's just you. You guys make the decision together. Okay, awesome. And do you have any
Yeah,
plans? It's up there's to bounce around the ideas, then because sometimes listen, it's needed. So
yeah.
um So as far as like other disciplines go, I know you said you have OT, right? Do you have any PT or speech, or it's just OT?
No, we're just OTs and the personal trainer and our personal trainer who's great with the kids. We have had speech and PT in the past, but interestingly enough, the clients that we service have not. We haven't seen the need so much for PT. For example, we will get a referral here now and then, but not much. For speech, however, there's a big need, and the big issue with speech is that the hiring. We we haven't been able in the last 7 years to really build a team of speech therapists. Otherwise, we would have speech. And that is hard.
Okay, interesting. Okay, yeah, I do agree with you. I mean, especially in areas like the Bay Area, and I'm in New York. Hiring is challenging, right? A lot of
Yeah.
competition, and there's a lot of work. It's a good thing that there's a lot of work for therapists, but that's what happens. So, as far as hiring, what do you do for hiring?
So recently what we're doing is we take a lot of students and we hire some of the students that come through, and that's been successful because we can train them. However, it's slow. We have the traditional posts and things like that, and we are one of the things that we are having in the coming months is sort of like a meet and greet with just different professionals to showcase the space, particularly to like the doctors who refer us and other professional speech therapists and other OTs, and potentially, just continue to put the word out there that we're looking for therapists.
Interesting. Okay, so very good. And what are your kind of long-term goals for your business?
Long term, I think we definitely need another location, um, and we have to determine whether that's a franchise or whether that's just another location.
Yeah, and you guys. So again, you're two sole owners. Are you looking also into other areas, or you want to be in more where you are in the Bay Area?
Yeah, that's a tricky question because the Bay Area is expensive. And if we could be in different parts of California that might be a little bit, cheaper to operate, that would be better. However, the model that we run works here because we can tap into the community who has, potentially jobs at all of the tech companies here who have good benefits, who have the ability to pay for services and wait to get reimbursed. So yeah, that's why the model works here. I'm not sure if that could work somewhere else.
Makes sense. Makes sense. Okay, great. So last question for you is, do you have any kind of recommendations to others or words of wisdom on if they wanted to also branch out into their own business? Because earlier you mentioned that one of the reasons you are where you are is because of productivity and burnout and all of that. So anything you can share with other therapists?
Know your numbers. You have to know your numbers. As a therapist, that's my I wouldn't say my weak point. I like numbers, but just the time. But look at your financial data constantly because you need to make decisions based on that.
No, that's great advice. So one of the things at Hello Note that we do is reporting, and one of like actually our COO, he's very big on numbers. So he makes sure that our reports are top notch, like KPIs. So knowing your numbers is essential because that's kind of like your health of your business. So definitely appreciate mentioning that because there's a lot of practice owners that don't know their numbers. So you definitely want to do that in the beginning, as opposed to then
Mm,
catching up not knowing your
yeah.
numbers.
Yeah,
Awesome.
you wanna get into the habit of just knowing your numbers all the time.
Yes, yes, exactly. And it's better to start early than to start scrambling and looking back for numbers. So, and again, that's speaking from experience too, because when you start a practice, you might not know everything, and that's okay.
Right.
It's definitely appreciated to mention that because it is important, especially if you ever want to sell your business, right? Whoever wants to buy your business or buy into it, they need to know your numbers. And if you don't know your numbers, then you don't have much to sell other than, how you got to where you are. So Tanya, I appreciate your time. Appreciate getting to know you. And I look forward to doing a follow up as well if you're open to it. Do you have any other questions for me?
No, thank you for doing this. I think it's great to have a community, of people.
Yeah. Awesome. Awesome. Thank you very much, Tanya. And I'll speak to you soon. Thanks everyone for
Okay.
watching.
All right. Thank you.